Hi everyone, today I will present the article titled Severe Adenovirus Infection Outbreak in Colombian Experience from a Tertiary Pediatric Hospital in 2022, published in Biomedica in 2024. This study is important because it describes a major outbreak of severe adenovirus infection in children after the COVID-19 pandemic. First, what is the adenovirus? Adenovirus is a common virus that usually causes mild respiratory infection, especially in children under 5 years old. Most infections are self-limited, but some serotypes, particularly types 3 and 7, can produce pneumonia, respiratory failure, and even death. The researchers noticed an unusual increase in severe adenovirus cases during 2022 in Colombia. Because of this, they decided to study the clinical characteristics of affected children treated at Fundación Hospital Pediátrico La Misericordia, also known as HOMI, located in Bogotá. This was a retrospective descriptive study. The investigators reviewed medical records from January to December 2022. Initially, they identified 227 patients with adenovirus infection, but only 196 children met the criteria for severe disease. Severe infection was defined as requiring respiratory support or vasoactive support in the pediatric intensive care unit. Now let's discuss the most important results. The median age of the patient was only 2 years old, meaning that very young children were the most affected population. In addition, 62% of the patients were male. Clinical, the most common symptoms were upper respiratory symptoms present in almost 18% of the patients, followed by fever in about 70%. Some children also had diarrhea, conjunctivitis, and skin manifestations. An important finding was that many children had co-infections. About 69% have another respiratory virus in addition to adenovirus. Bacterial infections were also frequently identified, especially in respiratory secretions. Regarding disease severity, almost all patients, around 97%, require admission to intensive or intermediate care units. Most children needed respiratory support. The median hospital stay was 18 days, which demonstrates how severe these infections were. Furthermore, many children were discharged still requiring oxygen therapy. One of the most concerning findings was the mortality rate. The in-hospital mortality reached 11%, which is much higher than the rates reported in previous Colombian studies. Most of the children who died already have comorbidities. When restrictions were lifted, respiratory viruses returned with greater intensity, causing unusually severe outbreaks in a more vulnerable pediatric population. In conclusion, this study shows that Colombia experienced a major outbreak of severe adenovirus infection in 2022, especially affecting children under 5 years old. The outbreak was associated with high ICU admission rates, respiratory failure, prolonged hospitalization, and increased mortality. The article highlights the importance of epidemiological surveillance, viral genotyping, and early recognition of severe respiratory infection in children after the COVID-19 pandemic. Thank you for the attention.